So what are gallstones? Gallstones are solid, pebble-like material that form inside the gallbladder. The gallbladder is a sac-like organ located under the liver. The gallstones can be the size of a grain or even as large as a golf ball. Whew. Imagine this is sitting in your gallbladder. Imagine the pain. Luckily, the majority of gallstones are smaller than 1 inch, which is about 2.5 centimeters in size. 80% of gallstones are cholesterol gallstones. The other 20% are pigment stones. So what causes gallstones? The liver makes and releases bile. Bile is stored in the gallbladder, and bile is a greenish brown fluid, and the gallbladder not only stores it, but it also concentrates the bile. So when we eat a meal, let's say we're having a good hearty fatty meal like a good old cheeseburger dripping with cheese on the side, the gallbladder says, I need to do something about this, and gets active and contracts, and bile flows from the gallbladder to the small intestine to help with digestion. In between meals, the gallbladder is relaxing, allowing the bile to flow into the gallbladder. Now, if there's too much cholesterol or too much of another substance called bilirubin or not enough bile salts, gallstones may form. Also, if the gallbladder does not empty completely or not often enough, gallstones can also form. So how many people are affected, especially here in the US, by gallstones? On a yearly basis, more than 1 million Americans are diagnosed with gallstones. Your physician might use the term cholelithiasis. And if you're wondering what happens if you're on too many medications, click on the link above. So are you at risk for gallbladder stones? So these are the risk factors. Having a family history, especially if you're a woman over the age of 40, if you're obese, if your diet is high in fat but low in fiber, if you're frequently fasting, rapid weight loss, or for that matter, lack of exercise, use of birth control pills or hormone replacement therapy, if you're pregnant, diabetes, a hemolytic anemia such as sickle cell disease, cirrhosis of the liver. So if you're finding value in this video, don't forget to like, share, and subscribe, and might as well hit that notification bell. So what are gallbladder stone symptoms? The classical symptoms are you have pain after eating a fatty meal. You have abdominal pain located classically in your right side of your belly with radiation to your right shoulder or to your back. You might be vomiting or feeling nauseous. Some people present without having eaten anything with pain, and usually they have symptoms around midnight. Having said that, many people have silent gallstones, meaning they are found incidentally during a CAT scan or an ultrasound. And if the stones are not symptomatic, they do not need treatment and can be monitored by your provider. So how to diagnose gallstones? The most important initial test would be a physical examination by your provider, coupled with specific blood tests to rule out signs of infection as well as blockage. The next test would be an ultrasound, which is a non-invasive test looking at your gallbladder, which can pick up stones. Most of the time, a diagnosis can be established by these tests. However, if the diagnosis is not conclusive, your doctor might order a CAT scan to get a more detailed view of the gallbladder, liver, and bile ducts. Your doctor might also order another test called a HIDA scan, especially if the gallbladder is acutely infected, coupled with a blockage of the gallbladder outlet. It is also used to look at gallbladder disease without any stones, known as acalculous cholecystitis. Then there are two other specialized tests. One is called MRCP and the other ERCP, especially to look at gallbladder stones blocking the bile ducts. During an ERCP, the added advantage is not only diagnosing a gallbladder stone in the bile duct, but also removing it. So the reason you want to avoid symptomatic gallbladder stones is to avoid gallbladder stone complications. If the gallbladder becomes blocked by a stone or several stones, it can cause an inflammation of the gallbladder. This presents as pain which is constant, especially in the right upper side of your belly, and fever is common. Older adults can present atypically without a fever and sometimes even without pain. If not treated, this can lead to a rupture of the gallbladder, which is an acute medical emergency. If stones leave the gallbladder and cause a blockage of the bile ducts, it's called choledocholithiasis. Typical symptoms are fever, abdominal pain, chills, as well as jaundice. This is a yellowish discoloration of the skin and the white of your eyes. It can also cause an inflammation of the pancreas. This is another medical emergency requiring immediate treatment to remove the blocked stones or the blocked stone. And this can be done by means of an ERCP. So how do we treat gallbladder stones? If you don't have any symptoms, you do not have to be treated. Your doctor would monitor you and give you advice about diet, hydration, and lifestyle changes. Some small stones can pass through your body on their own. If the stones continue to be symptomatic and cause problems, your doctor might offer one of two options. The first thing could be a laparoscopic cholecystectomy, which is the most common surgery for gallstones. Through a small cut in your belly, your doctor passes a narrow tube called a laparoscope. It holds a camera and light, and during this procedure, your gallbladder is taken out through another small cut. Usually you can be discharged the very same day. The other surgical procedure requires you to stay at the hospital for a couple of days. During this procedure, called an open cholecystectomy, gallbladder is removed using a bigger cut in your belly. As I mentioned earlier, if gallstones are in your bile ducts, your doctor might use a procedure called ERCP to find and remove the gallbladder stones before or even during surgery. Non-surgical treatments are usually offered if the risks of surgery are too high. This was offered to one of my patients recently as she had multiple cardiovascular risk factors. The disadvantage with this option is that the stones can reoccur after some time. Your doctor might use a bile acid pill to dissolve cholesterol stones called ursodiol. A side effect of the medication is diarrhea. You will have to be on this medication for several years as it takes years to dissolve the stones. And if you're interested in the side effects of other medications, click right here. My patient was offered a percutaneous removal of stones. During the procedure, a small plastic tube is inserted into the gallbladder to drain the bile caused by the obstruction of stones. So the most important thing, how can you prevent a reoccurrence of gallbladder stones and its problems? So your diet should include low-fat dairy foods, whole grains such as brown rice, oats, bran cereals, whole wheat bread and whole wheat pasta, lean meats and poultry, fish, fresh fruits and vegetables. You should avoid the following foods such as fried foods, highly processed foods such as cookies and pies, whole milk dairy products such as cheese and butter and ice cream, fatty red meat, and exercise regularly. I would recommend about 30 minutes 5 times a week. Question of the day: are you suffering from gallbladder stones? And don't forget to like, comment and subscribe. And if you're interested in other videos, click right here or here or here or here. Have a good day and think you're healthy. Done.